We're going to start in this first section, Jen, with just defining the significance from a historical perspective. Where are we with cancer screening, and how did we get there? Cancer is the number 2 killer of human beings.
Ugh.
Heart disease is number 1.
Mm-hmm.
Cancer is number 2. And I would just say that it's confusing, it's complicated, mostly because it's super scary, and it's hard to find consistent recommendations, screenings, treatment. Tends to be expensive and variable based on the market and resources that your community has. Why don't you help us and help the listener kind of catch up with where we are with cancer screenings, and how did we get here?
Sure. Well, thanks for that intro. As you and I were prepping for this, I think there's probably not a human on the planet that doesn't know somebody that has had cancer or hopefully overcome it. So screening for cancer is super important. You want to try to catch it early so that it doesn't spread. And historically, these cancer screening tests have been population health based. And what I mean by that is basically they look at the entire population and they look at, well, when did cancer become evident? At what age? What screening test can we reliably do to try to catch it early? In a lot of these cancers, the most popular one probably for a female being breast cancer, we have mammograms.
Mm-hmm.
For men with prostate cancers, we have blood tests, and then we can move to imaging if we need to. So imaging tests, blood tests. For some, like colorectal cancer, you have to go see a gastroenterologist and get a colonoscopy. So it's all over the board, and it's not individualized. As healthcare providers, when we meet with our members, we do a deep dive into their family history. We want to marry that with if you've had a grandparent with cancer, what kind? When did it happen? If you have a parent with cancer, what kind?
Mm-hmm.
When did it start? What treatment did they go through? If they did detect anything. But, we're kind of limited in the options that we can present people right now based on imaging, blood tests, those type of screening tests.
Well, yeah, especially since these standards are what insurance companies and third payers tend to base their decision to pay or not pay on.
Yeah.
And interestingly, this isn't any different than you and I in our practice of medicine. It isn't any different than the way we handle heart disease or performance or weight loss. We don't do population health.
Yeah.
We do health of one. And ironically, no healthcare provider actually does population health.
Right.
People who write recommendations do it based on population health. But if you're a practitioner of health and you have another human across from you, that's one-on-one. And if you don't have any capacity to augment your strategy based on the actual human sitting across from you, it's better than nothing.
Yeah.
Right? Which is the definition of population health. If you were going to hang a shingle in the middle of West Virginia where there's no resources, here is the bare minimum. Rather than recommend, they should call it the bare minimum.
Yeah. Yeah.
This is the minimal viable product to call yourself a health provider.
Well, and the other important point is that when we were researching out for this podcast, lung cancer is the number 1 cancer. Killer. Number 1 cancer killer of humans, which shocked me because we always hear about breast cancer in women or cervical cancer or, prostate cancer in men, but we don't have a great screening test for lung cancer. We don't have a great screening test for pancreatic cancer or ovarian cancer.
That's right.
I personally have a friend, she was a dietitian, ate super clean, worked out all the time, had a very strong history of cancer in her family, ended up with ovarian. By the time they found it, it was stage 4. And so with these deadliest cancers, and she's a perfect example, because we don't have great screening tests, by the time you do find them, it can be too late.
Right.
So, and that's another downside to the whole historical the way we
I think
tested for it.
I think the main take-home point of this first section is we have for the cancers that we have screening tests for, I think we do a really good job. Assuming you're getting these screenings. So
Right.
cervical, breast, prostate, colon. Do the basic. I
Yeah.
mean, absolutely. If you're not at least doing that, let's start there. But I think as a teaser for later in this episode, we're going to talk about something that we really both feel deeply passionate that needs more attention and conversation around, because people have options. There have been some emerging breakthrough technologies that we're going to talk about in a little bit that should be considered as we march forward in terms of cancer screening and early identification, because speed is the game. Early detection is the game.
Yeah.
Nobody wants to find ovarian cancer.
Right.
But if you're going to find it, let's find stage 1 where you live to talk about it.
Yeah.